Welcome to our educational segment on how to administer insulin correctly. If you or someone you care for has diabetes, understanding how to give insulin properly is essential for managing blood sugar levels effectively. Today, we will break down the steps involved in this crucial process, ensuring that you feel confident and informed. First, let's talk about the importance of insulin. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter the cells of the body. For individuals with diabetes, their bodies either do not produce enough insulin or cannot use it effectively. This is where insulin therapy comes into play. Administering insulin correctly can significantly improve blood sugar control and overall health. Before you begin, it's essential to gather all the necessary supplies. You will need your insulin vial or pen, a syringe or pen needle, alcohol swabs, and a sharps container for safe disposal. It's also a good idea to wash your hands thoroughly with soap and water to minimize the risk of infection. Next, let's prepare the insulin. If you are using a vial, gently roll it between your palms to mix the insulin, especially if it's a cloudy type. Avoid shaking it, as this can create air bubbles. If you're using a pen, check that it's properly primed by dialing the dose and releasing a small amount of insulin to ensure it flows correctly. This step is crucial, as it prevents air from entering the syringe or pen, which could lead to an inaccurate dose. Now, let's discuss the injection sites. Insulin can be administered in several areas of the body, including the abdomen, thighs, and upper arms. It's important to rotate your injection sites regularly to prevent lipodystrophy, which is the buildup of fatty tissue that can occur with repeated injections in the same area. When selecting a site, choose an area that is free of scars or lumps for better absorption. Once you've chosen your site, it's time to clean the area with an alcohol swab. Allow the skin to dry completely to prevent stinging when you inject. If you're using a syringe, draw the prescribed amount of insulin into the syringe, ensuring there are no air bubbles. If you see any, gently tap the syringe to bring them to the top and push the plunger slightly to expel them. For the injection, hold the syringe like a dart and insert the needle at a 90-degree angle for most body types. If you are thin or using a shorter needle, a 45-degree angle may be more appropriate. Insert the needle quickly and smoothly into the skin. Once the needle is in, press the plunger down steadily to inject the insulin. It's important to inject the entire dose to ensure you receive the full benefit of the medication. After you've injected the insulin, withdraw the needle quickly and apply gentle pressure with a cotton ball or gauze to the injection site. Do not rub the area, as this can affect insulin absorption. If you notice any bleeding, it's perfectly normal. Just apply gentle pressure until it stops. Finally, dispose of the needle and syringe in a sharps container. Never throw them in the regular trash, as this poses a safety risk to others. If you're using a pen, follow the manufacturer's instructions for disposal. In conclusion, administering insulin correctly is a vital skill for managing diabetes. By following these steps, preparing your supplies, choosing the right injection site, and ensuring proper technique, you can help maintain stable blood sugar levels and improve your overall health. Remember, if you ever have questions or concerns about your insulin regimen, don't hesitate to reach out to your healthcare provider. They are there to support you on your journey to better health. Thank you for taking the time to learn about this important topic and take care of yourselves.
If you're finding this video helpful, then you're definitely going to want to watch my free NCLEX webinar training, where I reveal what are the real-time secrets that I'm currently teaching my students that results in hundreds of repeat test takers finally passing the NCLEX exam. This is a training where I walk you through step by step what are some of the common myths and mistakes that you may be making that is resulting in you not passing your exam or not passing it when you do take it. In addition, you will get a free PDF bonus that will narrow down your focus so you know what to start doing right now to ensure you pass this test regardless of how many times you have taken it or how long you've been out of school. By the time you are finished with this training, you'll know exactly what you need to do so you can secure your nursing license and land your dream nursing job. Simply press the free training link either above or below this video to get access to it for a limited time right now.